Good day, ma'am. So today I will be performing the Leopold's maneuver. This is to determine the presentation and position of the fetus. It is performed after 24 weeks of gestation when fetal outline is formed, and we use this process to determine if complications will occur during the delivery and if the patients will require a cesarean section. So, Leopold's maneuver has 4 specific actions or 4 specific steps. The first one is the fundal grip, the second one is the umbilical grip, the third one is the pollex grip, and the fourth one is the pelvic grip. So, before we proceed to the maneuver, we need to do the proper hand hygiene to prevent the spread of microorganisms. We identify your patient using two identifiers, and then provide privacy and explain the procedure to our patient. Hi ma'am, I'm Rose Angel Lazur, and I will be your student nurse for today. So today, I will be performing the Leopold's maneuver wherein I will be putting my hand to your abdomen. Is that okay for you? Okay, so before we proceed, do you want to go to the restroom first? Okay, I will be putting you, ma'am, in a comfortable position. If you need to flex your knees. You need to flex your knees like that, and then I will put the linen so that only the abdomen will be uncovered. Okay, so before we proceed to the first maneuver or the fundal grip, we need to make sure that our hands is warm. For the first maneuver, after warming our palm, the first maneuver is the fundal grip. We put our hand to the patient's abdomen or the fundus, and then palpate the abdomen. We use this method to determine the head or the buttocks of the baby. So for the head, if we palpate it, and the head should be firm, hard, round, and it moves separately from the trunk. And the buttocks is symmetric and feels soft. So after that, we will now be moving to the second maneuver or the umbilical grip. While still facing the patient, we gently put our hand to the patient's side of the abdomen, and we gently put deep pressure. First is our left hand. This is to palpate the fetal back. If it is the fetal back or the fetal limbs and hands. Next is I will use the right hand. After we identify the fetal back of the baby, we now proceed to the pollex grip. For the third maneuver or the pollex grip, we use our only one hand or our thumb and our fingers. We put it to the lower abdomen of the patient. This is to validate our first findings or our first maneuver if the fetus is a phallic presentation or breech presentation. And of course, to know if the fetus is engaged. If the fetal head is engaged to the pelvic, it is not movable. The head is not movable. But if it is not engaged, the baby's head is floating, or we can move it upward. After we do that, we will now proceed to the last maneuver. By doing that maneuver, we need to face the patient's feet. this, and we will put our hand to the patient's abdomen. This process or this maneuver is to locate the fetus pro. We gently palpate. We determine if the fetal head is extended or not, and then we gently move our fingers. And after that, we now